My name is Jonna Pyle, and the following information has been prepared by myself as well as my partner Robin Gwynn for our EDS 522 class at the University of Kentucky. We were asked in this class to research and prepare information for a disability that we were not familiar with, and so we have decided to research agenesis of the corpus callosum because neither one of us knew much about it and we both found it really interesting. Agenesis of the corpus callosum is also referred to as ACC, and that's what I'll be referring to it in this presentation as. ACC is a rare birth defect in which the structure that connects the two hemispheres of the brain is either partially or completely absent. Girls typically have a gender-specific condition which is called Agenesis syndrome, and this causes severe mental retardation, seizures, abnormalities in the vertebrae of the spine, as well as lesions on the retina of the eye, which create really bad vision impairment. ACC can also create malformations in other parts of the body and create midline facial defects. Intelligence may be normal in ACC, but vision is almost always impaired, and it just depends on the severity of ACC in each person. And children that have severe brain malformations may tend to have intellectual retardation, seizures, spasticity, and hydrocephalus, which is where the person has an abnormal accumulation of cerebrospinal fluid in the cavities of the brain. The diagnosis of ACC can be found through an MRI, a CT scan, a prenatal ultrasound, or a prenatal MRI. So you can find out if a child has it before they are even born. ACC is caused by the disruption to development of the fetal brain, and this occurs between the 5th and 16th week of pregnancy. A lot of times it is unknown to what has actually caused ACC, but research shows that some causes could be due to chromosome errors, inherited genetic factors, prenatal infections or injuries, prenatal toxic exposures, structural blockage due to cysts or other brain abnormalities, and metabolic disorders as well. The signs and symptoms of ACC vary between each individual, but there are some common characteristics that you can look for. As I mentioned earlier, vision impairment is huge in ACC. Sometimes people will have low muscle tone, poor motor skills, delays in early development such as sitting, crawling, walking, trouble potty training. There's a low perception of pain, and there's a lot of times there's chewing and swallowing difficulties, as well as speech and language delays, and there are a lot of difficulties in social aspects according to our society. There are currently no medical treatments for ACC, but many people have found that developmental therapies can be very beneficial to the person who has ACC. There are many different kinds of therapies that they can have. It just depends on the person and what they need most. Most of the time, the specialists that are involved are neurologists, occupational therapists, physical therapists, speech therapists. You can have early interventionists and some education assistants. A person that has it by the name of Kim Peek, he was born with ACC, and he was actually the inspiration for the film of Rain Man. And if you want to see a video of him, you can go to YouTube, and the following link is http://www.youtube.com/watch?v capital N, capital J, lowercase j, capital A, lowercase b, lowercase s, a dash, 3, lowercase k, lowercase c, and 8. And you can check that out at YouTube at the following link, and Also, if you're interested in more information about ACC, please check out the following resources for families. There is the March of Dimes Foundation, there's the Agenesis of the Corpus Callosum ACC Network, there's the National Organization for Rare Diseases, and the National Organization for Disorders of the Corpus Callosum. And all of these websites are very beneficial to people who are looking to seek out more information on this rare disease, and we hope that you really benefited from our presentation. Thank you.